Добрый день, уважаемые коллеги.
Good morning, dear colleagues. Let me declare open a session of the Dissertation Council for the Thesis by Osipova Natalya Anatolyevna for the degree of Doctor of Medical Sciences, Academic Specialty 140101, Obstetrics and Gynecology, on the theme Incontinence in Uncomplicated Pregnancy and Women of Reproductive Age, Pathogenesis, Principles of Diagnosis and Management Tactics. By the order of Academic Secretary of St. Petersburg University, Gniotov Alexander Valentinovich of the 11th of February 2021, number 1053/1, with annexes, order of the 16th of February 2021, number 1148/1, me, Ailamazan Eduard Karpers, academician of Russian Academy of Medical Sciences, Doctor of Medical Sciences, Professor of Department of Obstetrics, Gynecology and Reproductive Medicine of St. Petersburg University, was appointed chairman of this Dissertation Council. Other members of the Dissertation Council were appointed with the same order: Arzhanova Olga Nikolaevna, Doctor of Medical Sciences, Professor of the Department of Obstetrics, Gynecology and Reproductive Medicine, St. Petersburg University; Rusina Elena Ivanovna, Doctor of Medical Sciences, Senior Researcher, Professor, Department of Gynecology and Endocrinology of Odd Research Institute of Obstetrics, Gynecology and Reproductive Science; Smirnov Alexey Vladimirovich, Doctor of Medical Sciences, Professor, Head of the Department of Reproductive of Internal Medicine, Pavlov First St. Petersburg State Medical University. In the remote access mode, Mozgova Yelena Vitalna, Doctor of Medical Sciences, Professor, the Obstetrics, Gynecology and Reproductive Medicine Department of St. Petersburg University. Yelena Vitalyevna, can you see and hear us? Yes, I can see and hear you very well. Rukhlada Nikolai Nikolaevich, Doctor of Medical Sciences, Professor, Head of Department of Obstetrics, Gynecology and Reproductive Sciences of St. Petersburg Pediatric Medical University. Nikolai Nikolaevich, are you with us? Yes, thank you for introducing me. Thank you. Kamilova Marhabo Yedgarna, Doctor of Medicine, Tajik Scientific Research Institute of Obstetrics, Gynecology and Perinatology of Tajikistan. Can you hear and see us? Marhabo Yedgarovna? Yes, Eduard Karpovich, thank you for introducing me. Thank you. We are glad to have you with us. Petros Peter Emmanuel Papa, PhD, University of New South Wales, Australia. Let me ask our colleague, can you see and hear us? Please say yes, if you can. Hello.
Okay, yep. I'm here, yes, thank you.
Also, the degree applicant is present. Also, at the session, the academic advisor of the applicant, Niauri Dariko Alexander, Doctor of Medicine, Professor, Head of the Department of Obstetrics, Gynecology and Reproductive Science of St. Petersburg University. To improve the quality of communication, dear colleagues working in the remote access mode, please keep your microphones switched off, but remember to turn them on when you're given the floor. Let me also inform you that our session is being recorded and broadcast online as the Petersburg University website. The speeches are being simultaneously translated from Russian into English and from English into Russian. During the live broadcast of the Dissertation Council session, at the moment an email is displayed, to which, during the session, all the listeners may send their questions to the applicant and send their opinions regarding the content of the thesis and the applicant's speech, the ongoing scientific discussion, and thus take part in the discussion. These questions shall be forwarded to me by the Technical Support Department, and I shall present them during the discussion. Questions should be related strictly to the applicant's speech and the content of the thesis. It's necessary to indicate full name, position, and place of employment of the author. Questions that are not related to the scientific discussion of the thesis, the text and assessment of the thesis, shall not be presented. In accordance with the order of awarding degrees at St. Petersburg University, the degree of Candidate of Sciences and Doctor of Sciences approved by the local regulations, of the university, a session of the Decision Council shall be considered competent if at least 2/3 of the appointed council members are present, but not less than 4 persons. Our Dissertation Council consists of 8 persons. All 8 are present, including 4 council members in the remote interactive mode. Audio-visual contact has been established to them. Thus, we have the quorum. I have to set forth the following procedure for today's session, with approximate duration of approximately 2 hours. First, summary information from the chairman about the applicant and documents submitted by the applicant and their compliance with applicable regulations. Answers to possible questions, approximately 5 minutes. Second, applicant's summary report outlining the key points of her research, up to 20 minutes. 3. Questions to the applicant strictly on her report, no more than 2 minutes for each question. Answers of the applicant, no more than 5 minutes for all answers. 5. Speeches of all the council members in turn, with their assessment of the thesis and the applicant's speech, as well as questions and suggestions to the applicant, approximately 10 minutes for each speaker. 6. Speech of the chairman with his assessment of the thesis, up to 10 minutes. 7. Answers of the applicant to questions and remarks of the council members, no more than 20 minutes. 8. Open discussion, speeches at will of the attendees, with summaries of their opinions and specific questions and suggestions to the applicant, strictly on the theme of the study. No more than 2 minutes for each speaker. At that, all the speakers are kindly requested to register in the registration sheet and introduce themselves before speaking. 9. Chairman presentation of questions to the applicant received during his speech and the scientific discussion. As the session has been broadcast online, let me inform you that written questions, the reading of which takes more than 2 minutes, shall not be presented. 10. Answers of the applicant, no more than 2 minutes for each question. 11. Speech of the academic advisor of the applicant, no more than 3 minutes. 12. Discussion of the council members before open voting of the defense results. For that period, sound shall be switched off. 13. Open individual voting. The chairman shall count the votes and the results shall be recorded in the minutes of the meeting. 14. Make a decision on awarding or non-awarding the degree to the applicant. And finally, closing remarks of the applicant, not more than 2 minutes. Dear colleagues, do you have questions or objections to this procedure? If there are no questions, let's start our session. First of all, please switch off your mobile phones. Dear council members working in the remote access mode, please keep your microphones on in order so we could reach you in case of emergency. Thank you for your understanding. Let's start our session. A thesis by Osipova Natalya, Anatolyevna, of the degree of Doctor of Medical Sciences, Academic Specialty 14-0101, Obstetrics and Gynecology, on the theme Incontinence in uncomplicated pregnancy and in women of reproductive age. Pathogenesis, Principles of Diagnosis and Management Tactics, was accepted for defense by the order of the Academic Secretary of St. Petersburg University of the 20th of January 2021. Osipova Natalya Anatolyevna wrote her thesis at St. Petersburg University under the guidance of Doctor of Medical Sciences Professor, Head of Department of Obstetrics, Gynecology and Reproductive Medicine of St. Petersburg University, Nyaury Dariko Alexandrovna. The number of publications of the applicant which set forth the main scientific results according to the enclosed list is 13. In peer-reviewed journals from the list approved by the Ministry of Science and Education of Russian Federation, 13 publications. In journals indexed in scientometric databases Web of Science and Scopus, there are no publications. The applicant submitted to the Academic Secretary of the University a full set of documents to accept the thesis for consideration and defense. and all the documents comply with Article 12 of Section 3 of the Order. All the documents submitted by the applicant according to information are received from the curator, comply with the requirements, and are kept in the applicant's attestation file. Copies are available from the Dissertation Council Activity Support Department, who is now present at our session. Before I give the floor to the applicant, I have a question to the Dissertation Council. Dear Council members, do you have any general questions to the applicant, and is it necessary to read the full list of documents submitted by the applicant? No such questions. In that case, I suggest you start your presentation. Welcome. Dear Eduard Karnovich, dear Council members, dear colleagues. Incontinence is a problem in 1 in 5 women of reproductive age, even in the absence of significant manifestations of pelvic floor insufficiency. According to some data, the loss of small amounts of urine during pregnancy occurs in almost all women examined during pregnancy, and after the first birth, the incidence of incontinence reaches 30%. In 50% of women with urinary incontinence, urine flow disorders are combined with nocturia associated not only with organic and functional disorders, and in 50% of cases. The current standards differentiate is not included, and no such research is conducted. Urinary incontinence is often an indication for surgical treatment, but after reconstructive surgery, with the use of modern prostheses, the symptoms of urinary incompetence persist or occur de novo in 10 to 30% of women. Conservative therapy aimed at correcting the functional mechanisms of urinary incontinence is based on the effect of the choline and adrenal receptors in the lower urinary tract. However, after 1 year of treatment, adherence to medication does not exceed 30% due to adverse reactions and insufficient effect. Therefore, the search for new pathogenically based treatments for urinary incontinence in women is ongoing. Advances in the study of bedwetting in children have been used to address the problem of urinary incontinence. A woman aged 18 to 80 with sufficient effect of medication, a synthetic analog hormone has been shown to be effective, but this has never been justified. Previous studies have not assessed the daily rhythm of urine formation, and there are no data on the ratio of tubular apparatus in the activity of kidney in women with urinary incontinence. Also, the previous experience focused on explanation of adaptive mechanisms and pathogenic mechanisms of normal pregnancy does not allow to long-term control of women of reproductive age. In this regard, the aim of the study was defined to develop pathogenically sustained diagnostic principles and management tactics for pregnant women and women of reproductive age with urinary incontinence. The following objectives were formulated in order to achieve this goal. In women of reproductive age with different types of urinary incontinence, the following was determined: peculiarities, diuresis, daily rhythm of urine formation and excretion, mechanisms responsible for excessive urine output, osmo and iron regulating renal function. In women of reproductive age with different types of urinary incompetence, we evaluated the clinical efficacy and specific effects of synthetic vasopressin analog and a prostaglandin synthesis inhibitor on bladder storage function. clinical efficiency of vasopressin and inhibited cumulative function of bladder function. In pregnant women with urinary pregnancy, the nature and frequency of urinary disorders. In pregnant women with urinary incontinence, the osmo and iron regulating function of the kidneys was determined. Based on the inclusion criteria presented, we examined over 1,900 women of reproductive age, of whom 103 were in urinary complaints, and among pregnant women, the group was studied 1 year after pregnancy. The group was of nocturia with daily and his complex urodynamic examination. Exclusion criteria included surgical treatment for urinary incontinence, hysterectomy, pelvic organ prolapse, continuous or intermittent bladder catheterization, disease or taking medication with potential impact on renal and lower urinary tract function, medical and non-medical treatment for urinary incontinence in the 6 months prior to being included in the study. Additional criteria for exclusion included presence of incompetent symptoms before pregnancy, use of additional reproductive technology, and during the current pregnancy. Additional criteria for non-pregnant women was hysterectomy. Complaints were assessed on the basis of validated questionnaires, assessment of possible manifestations of pelvic organ prolapse, and urine flow rate according to recommendations of the Urinary Retention Society. The type of urinary incompetence was determined on the basis of a comprehensive examination, including urovesical segment, ultrasound scan, and urodynamic examination. Special formulas were used to assess renal, glomerular function and the tubular transport, such as osmotic concentration in reabsorption, osmotically free water excretion, excreted fraction, and ion clearance. The analysis of urine diaries showed that irrespective type of incontinence in women of reproductive age, the daily urine output and the number of urinations, including nocturnal urination, was significantly higher than in the control group. The causes for frequent nocturnal urine are decreased nocturnal bladder capacity, nocturnal polyuria, a combination of factors. The frequency of daily polyuria in women with urinary incontinence is 10%. Nocturnal polyuria is 2.5 times higher. Daily and nocturnal polyuria are equally common. When analyzing a small of blood serum of women with urine incontinence, the ability to has been preserved. The results allowed us to formulate the first provision to be defended. In women of reproductive age with urinary incontinence, impaired urinary control is combined with daily or nocturnal polyuria in 10% of cases. The detection rates of general and nocturnal polyuria are comparable in all types of urinary incontinence. The ability to maintain water electrolyte homeostasis in women with daily and nocturnal polyuria is not impaired. A study of renal osmoregulatory function, regardless of the type of urinary incontinence in women with daily and nocturnal polyuria compared to the control group, revealed increased reabsorption of osmotically free water and osmolar clearance, while the glomerular filtration rate did not change. These findings These findings, as well as the relationship between the suggests that changes in rate in women with urinary incontinence during daily and nocturnal polyuria may be due to changes in the tubular ion transport. Assessment of with polyuria enabled us increase of these indicators compared to control group data. This excretion of sodium ions suggests that the ion transport is altered of the Genli loop. A decrease in reabsorption of sodium magnesium ions in the thick ascending part of the Genli loop determines an increase of volume of fluid entering the subsequent parts of the nephron. Ion exchange process take place in distal convoluted tubular. Sodium is absorbed and potassium secretion increases. Large volumes of fluid enter the collecting tubes, where there are large opportunities for absorption of additional amounts of water, which is valid evidenced by the relationship with osmolar clearance and reabsorption of free water. Thus, reabsorption and diuresis both increases. So this is common for women in urine incontinence. The results obtained allowed us to formulate the second revision to be defended. Irrespective of the type of urinary incontinence, increased diuresis in women of reproductive age with general and nocturnal polyuria is caused by altered regulation of ion transport in the cells of thick ascending part of the Genli loop. A decrease in reabsorption of small molecularly active substances in this part of nephron leads to an increase in the volume of fluid entering the collecting tubes. A synthetic method of anti-diuretic hormone as a prostaglandin inhibitor of women with daily and nocturnal polyuria were used to correct impaired sodium ion transport. In closely located sections of regions of the nephron of Genli loop and in collecting tubules more of free water. Prostaglandin E2 secreted the cells of thick ascending loop of Genli loop acts locally and acts as an antagonist of antidiuretic hormone. Accordingly, blockade of prostaglandin E2 synthesis will potentiate the action of endogenous vasopressin. The doses of drugs used to adjust individually with inhibitor of prostaglandin synthesis. The doses of drugs used were adjusted individually, increasing in 7-day intervals. The dose was considered effective if there was a reduction in diuresis, fewer episodes, and less uncontrolled urine loss. A follow-up period of at least 3 months was observed. The efficacy of synthetic vasopressin analog and the prostaglandin inhibitor was independent on the type of urinary incontinence. Adverse events occurred at equal frequency of about 10% and warranted withdrawal only in 3 cases due to headaches. Under the influence of synthetic vasopressin analog and prostaglandin synthesis inhibitor, regardless of the type of incontinence in women, decreased with the values of the control group. The number of episodes of urinary disorders decreased. The number of episodes with stress urinary incontinence did not change significantly, but the amount of lost urine decreased significantly in all types of incontinence. The results obtained made it possible to set forth the third provision to be defended. The use of synthetic analog of vasopressin or an inhibitor of prostaglandin synthesis, regardless of the type of urinary incontinence, reduces diuresis, normalizes the daily rhythm of urine formation, reduces the number of episodes and volume of uncontrolled urine loss due to its effect on ion transport in the thick ascending part of the Genli loop. Based on the urogynecological questionnaire, diuresis and functional tests, we found that urinary changes in women with uncomplicated pregnancies were predominantly manifested by symptoms of bladder storage disorders, with increased frequency as the pregnancy progressed. In the first and second trimester, the frequency close to 50%, imperative incontinence. In the third trimester, stress incontinence prevailed. A mixed type was identified in nearly 10% of pregnancies. 1 year after delivery, urinary control was spontaneously restored in almost 90% of women. At 4% of cases, symptoms of stress incontinence persisted in 3 imperative and in 2.5 of mixed type. The results allowed us to set forth the fourth provision to be defended. Urinary incontinence in women during uncomplicated pregnancy is transient and mainly manifests as symptoms of impaired bladder storage function. The frequency of these disorders increases. The progression of pregnancy, imperative type incontinence prevails in the first and second trimesters. Stress incontinence in the third trimester, and the mixed type is found with equal frequency in all trimesters of pregnancy. Assessment of renal osmoregulatory function in pregnant women compared with non-pregnant women. Increase of diuresis, reabsorption of osmotic free water, and osmolar clearance. Assessment of iron regulating function in pregnant women compared with non-pregnant women identified increased sodium ion excretion. No significant differences were found between non-pregnant women. So we managed to, depending on pregnancy period, comparative analysis of iron regulating function in pregnant women, symptoms urinary, and those in pregnant women preserved urinary control. No significant differences were found. In pregnant women with symptoms of urinary incontinence and in pregnant women with preserved urinary control, a relationship between diuresis and sodium ion excretion was obtained. No relationship between diuresis and glomerular filtration rate could be obtained. Reduced reabsorption of sodium ions in one part of nephron causes more water and ions to reach the collecting tubes, thus allowing more water to be reabsorbed into the medulla on the one hand and increasing diuresis on the other, as shown by the relationship between diuresis, reabsorption of osmotically free water, and sodium ion clearance. The results obtained allows us to set forth the fifth provision to be defended. The functional state of kidneys in women with urinary incontinence in uncomplicated pregnancy, regardless of the type of incontinence, is characterized by increased diuresis, reabsorption of osmotically free water, osmolar clearance, and increased sodium ion excretion. The value of diuresis correlates with the level of sodium ion excretion and is independent of glomerular filtration rate. The trends and values are similar to those found in pregnant women with preserved urinary control. The results confirm that women of reproductive age with urine incontinence, general and nocturnal polyuria, can have diagnostic significance and explain pathogenetically oriented treatment methods. Thank you for your attention. Dear colleagues, thank you very much. Do we have questions on the Olga Nikolayevna? Professor Rozhanova, welcome. Dear Natalya Anatolyevna, your presentation is very interesting about sodium excretion increase. One of the principles of is reduction of salt and sodium preparations. What do you think? Is it necessary to do this, or is it possible to give up this practice? Thank you. Dear Olga Nikolaevna, thank you for the question. At present, during normal pregnancies, is not recommended to reduce absorption of liquids or limit salt consumption. Thank you. More questions? Anybody? Do we have more questions? Elena Vitalyevna, welcome. Dear Natalya Anatolyevna, please tell us, in pregnant patients with urinary incontinence, did you offer any treatment, or did they just take part in the study? Dear Elena Vitalyevna, please repeat your question. I didn't hear it. The patients, pregnant patients you examined with polyuria and who complained, have you just examined them, or have you given them any recommendations? Dear Elena Vitalyevna, thank you for your question. No special examinations. We conduct no special symptoms of urinary disorders in pregnancy do not lead to significant reduction of life quality, and pregnant women themselves usually do not make any special complaints. In severe cases, behavioral therapy that includes urine diaries and delayed urination. Also, we could recommend exercises for pelvic, for pregnant women, and in-depth urodynamic examination if symptoms persist during 1 year. Please remember to, as I understand, we have not received any external reviews. Dear colleagues, according to the according to the procedure, we have to terminate our session, so let me call a technical break. Our colleague is back, so let's finish a technical break and let's continue. And according to the plan, let us hear the reviews of the dissertation council members. Since all the reviews were published at university website, I invite you to make it short and just focus on the key points that you would like to touch upon. And first, I'd like to give the floor to Professor Rozhanova Olga Nikolaevna. Dear Eduard Karpovich, dear Natalya Anatolyevna, dear colleagues, the work of Natalya Anatolyevna is very important because she managed to identify very important points, because pregnant women, as she said, never complain of urinary incontinence during pregnancy, and young women pay little attention to this. So treatment is administered at later stages. That is why the importance of this study is obvious. The author obtained reliable data on the changes in a smaller function of urine. The change of the nature of this process, polyuria, daily, general and nocturnal polyuria, and the study helped to clarify pathogenesis of urine incontinence in young women, including pregnant women. Data and facts provided treatment with synthetic prostaglandin analogs and vasopressin indicate the possibility for treatment, but this therapy conducted by non-pregnant women, administered to non-pregnant women, and adherence to therapy is another important aspect of the study, though surgical treatment in 1/3 of cases, so conservative treatment is extremely important. This study fully corresponds to the necessary principles of defense of doctoral thesis, and I support the study. Thank you for your attention. I support awarding the degree. Thank you. Thank you. Thank you. Next, I will give the floor to Professor Moskvaya Elena Vitalyevna. Elena Vitalyevna, can you hear us? Elena Vitalyevna, yes, I can hear you. You're given the floor. Please present your review. Dear Chairman, dear Council members, I'd like to say that the problem of incontinence in obstetrics and gynecology is getting lots of attention. At the Ott Institute in recent years, many studies were conducted, and Professor Rochlina, who's present here, conducted lots of work in this field. But this work was mainly connected with urodynamic changes in the pelvic floor muscles, which is so this work appears to be very important, the regulatory function of kidneys, and the author obtained very interesting results. The work is very well structured. She clarifies pathogenesis and therapy suggested, which yields good results. What I would like to mention is a great number of examined women, almost 2,000 patients. This is great work. This was hard work, which led to such excellent results. As an expert, mostly working in obstetrics, I especially liked the part dedicated to pregnant women. And obviously that asthma regulatory function in pregnant women is also changed during pregnancy, but the author obtained very optimistic results on restoration of this function, and the author explained that in most pregnant women are okay. So the work is very interesting, and let me say again, it's very well structured, it's very easy to read, and deserves positive assessment. Thank you. Next, I'd like to give the floor to Rusina Elena Ivanovna. Dear Chairman and dear Council members, dear colleagues, dear Natalya Anatolyevna, I would like to thank for the opportunity to take part in this session of the Dissertation Council on such an interesting topic at such a respected establishment. I've been watching this study for a long time because it's working with women with incontinence is my specialty. And I'd like to say that in every day I come across such patients, and every patient is unique. There are in our clinical protocols we have many templates, but of course we should consider individual situation of each patient, and of course in addition to pelvic floor condition, each patient has other accompanying diseases, psychological status, And this study is dedicated exactly to this, and conducted at such an institution where it was possible to study the pathogenesis of various conditions. So is a juncture of sciences such as obstetrics, gynecology, even psychiatry. So it's good to see that obstetricians assume this role, because somebody has to do it and assess all other studies. So it's a very interesting with the study of pathogenesis. The data is well validated, practical recommendations to doctors on diagnosis and treatment. So I can only congratulate the applicant and her academic advisor on completing such a major work. And so my opinion is positive. I have a question, though. I would like to know your opinion. How can you develop this study? Dear Yelena Ivanovna, thank you for your review and the question. We can assess efficiency of complex treatment with the use of antidiuretic, anti-muscarine, and adrenomimetics. Possibly such scheme will allow to reduce medication doses that will reduce adverse effects and increase patient adherence. Thank you very much. Thank you. Nikolai Nikolaevich Ruhlada, professor, will present his review. Dear Eduard Karpovich, dear council members, let me briefly focus on the key positive points of the thesis. I'd like to start by saying that the author is very unusual person. The scope of your scientific interests is really wide, covers not only gynecology but other sciences as well. So in this study we were able to see an interesting combination of approaches. For me as a surgeon, incontinence or stress incontinence these are two clearly well described in literature mechanisms. So I have never in literature never seen it linked to simple physiological components such as water balance. And maybe the value of this thesis, its scientific novelty, is in the fact that this development of pathogenical principles of incontinence of women has its peculiarities, and it cannot be evaluated solely from the traditional point, hyperactive bladder or anatomical defects or stress incontinence. And the results of such a study, such a thesis, mechanisms of urine formation, well explained and proven efficiency of application of vasopressin analogs and inhibitors of prostaglandin synthase in women of reproductive age with different types of incontinence. The thesis is well written, and they won almost 1,900 women. That's a very large group. And while reading the thesis, I got some questions which I shall present now, which by no means reduce the significance of the work, but only indicate my interest. And before I read the questions, let me say that the thesis fully complies with the necessary requirements applicable requirements of applied to such works. And my opinion is that I support the thesis, and I shall vote for awarding the thesis, as I have already done, given the positive review. So I would like Natalya Anatolyevna to answer 3 questions I set forth. The first is, in how many patients has there been a combination of both stress component of incontinence and overactive bladder? Second, can you tell me how effective in treatment of nocturnal polyuria to restrict water intake at night? So that is behavioral correction. How common was polydipsia, and what methods were used to assess the water balance? What scales or methods did you use for this? Thank you very much for your answers in advance. Dear Nikolai Nikolaevich, thank you for the positive review and questions. After a comprehensive urodynamic examination of 409 women with complaints of urinary incontinence, the mixed type was established in 130 cases. Women with urinary incontinence is typical of behavioral response in the form of restricted fluid intake, which, however, did not result in significant symptom relief. With nocturnal polyuria, the volume of fluid drunk was recorded by the women in urine diaries, and in 10% of patients it ranged between 3 and 4 liters. When these women were examined according to guidelines for management of polydipsia, polyuria was found to be unrelated to water diuresis, and serum osmolality was not reduced. In order to identify possible side effects when taking vasopressin analogs and the change of water balance, in addition to water balance control, we controlled body mass and sodium content in blood serum 3 days after the treatment was started. Next, we give the floor to Professor Smirnov. Dear Eduard Karpovich, dear council members, for me, it's an honor to attend a session at the university together with colleagues, obstetrics, as a nephrologist. The theme of is not really. So let me get back to the opinion of the previous speaker, who underlined, when we talk about urinary incontinence in women, first thing that comes to our minds is some abnormalities of pelvic floor development. So something that can be corrected with surgical treatment. And the work of Natalya Anatolyevna is important because she used strict criteria of exclusion of women in whom urinary incontinence could be connected with development abnormalities. And because of that, the theme of the topic focuses on nephrology, on the nephrological aspect, which is the basis of pathogenesis of such type of incontinence. And from the point of nephrology, this topic could best tubular dysfunctions in women with incontinence symptoms, because exactly this fact was clearly stated by the author. The author managed to demonstrate that increased erection or reabsorption electrolytes in upper part of gently loop results in higher diuresis, results in, and nocturia leads to false sense of incontinence. This is not incontinence proper, bladder has to be emptied, and at night women have to go to toilet several times, and this fact is assessed as one of the symptoms of this dysuria. This is polyuria, this nocturia, which results from functional reasons. Natalya Anatolyevna went even further. She studied osmolality and electrolytes mentioned here. She also tried to influence these physiological mechanisms with using the knowledge that is currently available, and for that purpose she used vasopressin and prostaglandin as inhibitors, and that way she managed to prove another mechanism of dysuria in women of reproductive age with a symptom that we can put in inverted commas, because I agree with Vitaly Nikolaevich, when we see patients with such a complaint, first thing we do is urology and gynecologist and surgeon examination to exclude the anatomical effects. The second part of the work is dedicated to the same symptom in pregnant women, and here, in my opinion, is very important. The important point is that in pregnant women, obviously, the same mechanism is present because of vasopressin and prostaglandin E2. Natalya Anatolyevna did not have the opportunity to administer such medication, but still we can discuss. But when we talk about pregnant women, pregnancy itself is a stress to normal kidneys. So when something goes wrong, of course this is certainly manifested during pregnancy. So this fact detected by Natalya Anatolyevna, and there was already a question asked by my colleague if salt intake should be limited. Sodium is lost. Is the reason for the symptom, which is well known when in pregnant women always want something salty, and for a nephrologist she should be given a free hand to consume whatever she wants, including salty products. And let me conclude briefly by saying that the thesis presented to us today is absolutely valid, is dedicated to a novel and unusual problem in obstetrics and gynecology, and it's easy to understand for a nephrologist than to gynecologist who doesn't have to analyze the subtle mechanisms of urinary disorders, which is our specialty. And that is why I think this work is written on impressive material. I can't think of another thesis which included 1,500 examined patients, or maybe more. So it seems to me that the amount of material used, the criteria for exclusion, which were explained to us and with which I started my speech, in reality the therapy which proved the existence of this mechanism reflects the pathogenic setup of this study. And finally, as clinical specialists, we got new insight into this symptom, which we will certainly use in our practical work. I think that the thesis the author deserves to be awarded the degree to the author. Thank you very much. Thank you. Next, give the floor to Professor Marhabo Yudgarovna Kamilova. Dear Eduard Karpovich, dear council members, dear Natalya Anatolyevna, for me, first of all, I'd like to say that for me, it's an honor to be among you and to take part in this defense, especially in the defense of such a relevant and important thesis written as the one written by Natalya Anatolyevna. Relevance of this work, of course, it doesn't need explanation. There's one point, important point. Many works are dedicated to studies in this field in older women, but much fewer works are dedicated to the study of this work and women on reproductive age. And the part dedicated to pregnant women who are also in reproductive age is also very relevant and very interesting. And the main criteria that explain why I support this work and why I believe it corresponds to the degree is that, of course, a scientific novelty, good contribution, defines the pathogenic mechanisms. That's where the theoretical significance is, and many points identified by the author in her study could be used in education and in planning further research. And one of such points is who are these pregnant women who are 1 year after pregnancy still preserve, in whom the symptoms persist 1 year after pregnancy, and how they should be treated. I also think that the economic component is also important, because the economic component of the study, surgery is one thing, but in some cases conservative is an altogether different story. The practical significance is also great, because suggestions made by Natalya Anatolyevna, everything is based on pathogenetically based therapy. So the therapy is clearly explained, from which shows the practical significance. So I fully support the work, and I think the work is timely, relevant, has good practical significance, and Natalya Anatolyevna should be awarded the degree of Doctor of Medical Sciences. Thank you. Thank you. The floor is given to Dr. Petros.
Okay. I have many questions, but let me start. Hold on. All right. In my assessment of this thesis, can I share the screen?
Покажите слайд. Кто может показать слайд?
Dr. Osipova, have you studied this paper by Sant, Dmytrovsky, Reddy, and Van Meulen? Are you familiar with this paper? Here it is. This paper here.
У вас нет вывода на экран, да?
Darren, I'm doing a PhD. I'm doing a PhD. Can I ring you later? I'm doing a PhD.
Yeah, sure.
Okay, thanks.
You're doing a PhD thing. All right.
Okay. Hello. Sorry about that. Dr. Osipova, are you familiar with this paper? Hello? Hello?
No?
Are you familiar with
No, unfortunately, I'm not.
Well, see, I am very concerned. In my assessment of your thesis, I said I would approve a doctorate if you eliminated all your recommendations that desmopressin was an effective clinical tool for nocturia. I hope you have removed that from your thesis, because if you look at this paper, it showed, if you read this here, if you look at it from a clinical perspective, taking in mind the placebo, the difference between the treatment groups and the control was 0.22 voids per night. It means if a woman was getting up 6 times a night, then we have the situation where she would only get up 5.78 times per night, which is of course ridiculous, and which is of course doesn't work. So I thought that your scientific work was excellent. I thought the way that you investigated your patients had very high scientific value, but I do not think that you can draw conclusions that desmopressin is the cure for nocturia. I would firstly like your comments on that. Will you please comment on this paper by Sand, Demachovsky and Reddy? There were a large number of patients, and that was their conclusion. Can you please comment on that?
Глубоко уважаемый.
Dear Professor, nocturia and polyuria can be connected with changes in reabsorption of ions in ascending part of Genli loop and with reabsorption of free water in collection tubes, and desmopressin, vasopressin affect the renal canals.
I know,
Maybe
I'm
in
aware
this
of that.
study.
I'm aware of that, but you have not answered my question. I'm saying to you that desmopressin is not clinically very effective. You claim in your conclusions that it was effective clinically and should be used in patients with nocturia. I'm asking you to comment on the paper. Can you read? I wrote a letter to the Journal of Urology, which was published, and this is my letter in part. I've put it on shared screen. Can you see that? Can you see the letter? Can everybody see the letter?
Yes, yes, okay. I can see the letter.
I would like your comments on it. I accept your scientific work. It is very good. But in the conclusion of your thesis, at least as I received it, you recommended that desmopressin should be used as the prime treatment for nocturia. Have you changed your mind, having read this analysis, which showed only a very small difference, 0.22 voids in a randomized trial? Let me ask you another question. Have you read anything about the treatment of nocturia by uterosacrum ligament repair. Have you studied that at all?
Excuse me, Dr. Pope.
Dr. Pope, please give us a minute. I will try to translate your question to the applicant.
Thank you. Paul, I'm doing a PhD dissertation. There's can I ring you later? Okay, thanks.
That's clinically ineffective, and that is why he would like the applicant to comment and show your data on patients. Did you detect any significant difference in patients who took vasopressin and those who didn't take it? And if you detected any side difference, so what's the statistical validity of this data? Is the question clear? So please, are you ready to answer?
Sorry, who are you talking to? Me or the candidate?
So the council member tried to explain your question to the candidate, and I just translated what she said.
Thank you.
Dear Professor, thank you for your comment. Unfortunately, I didn't have the opportunity to read this paper earlier, so I think I need to perform additional analysis of efficiency of desmopressin. But in the group of patients I examined, and the group of patients who had a deficiency of iron transport, we found this medication to be efficient. Maybe it's less efficient in other patient groups where polyuria is caused by other mechanisms.
No. How many patients did you give desmopressin to?
409 patients.
You gave what was the average nocturia in these patients?
И какова была средняя ноктурия у этих пациентов?
How many times a night?
А сколько раз за ночь они... It all depended on the type of incontinence. Patients with stress incontinence.
No. I'm talking about nocturia. Did you give desmopressin to patients with stress incontinence?
А вы назначали вазопрессин пациентам со стрессовым недержанием? We administered vasopressin with different types of incontinence.
Yeah, but who did you give it to? Who did you give desmopressin to?
Desmopressin we gave to patients with stress incontinence.
Well, and why did you give
and patients with mixed type of incontinence who had clinical manifestations in the form of nocturia.
So all these patients had nocturia, okay? Is that correct?
Да.
Yes, that's correct.
Okay. That's good. Now, so 409 patients had nocturia. Is that okay? Is that correct?
Yes, that's right.
Okay. What was the average number of nocturia episodes in these 409 patients? See, I didn't get this data. This is data I am seeing for the first time. But go ahead. What was the average number of nocturia episodes in these 409 patients?
Количество мочеиспусканий в сутки и
the urination episodes per day and per night depended on the type of incontinence.
Okay. But nocturia, you said 409 patients had nocturia. Nocturia, the definition being awakened in the nighttime by an urge to pass urine. Okay, that's the definition. Now, how many of your 409 patients had nocturia? That's a simple question. You should be able to answer it.
According to Professor Nocturia, in Russia they believe the definition is that the patient has excessive volume of urine at night. Is it
no,
not?
No, it's not. No. I refuse to accept that. That is not correct, what you are saying. Why? Because I have... I have read many papers from the St. Petersburg University urology department, and they use the International or IUGA Incontinence Society definitions, which are being awakened at night to pass urine. What you are saying is the definition from the Ferring company who are promoting desmopressin. So please tell me, how many of your patients have been awakened at night to pass urine? You can't make up your own definitions. These are international definitions.
Все пациенты просыпались ночью для мочеиспускания, и количество мочеиспусканий достигало 6 за ночь.
All my patients were awakened at night by the urge to go to toilet, to urinate. And the number of urinations was up to 6 times per night.
Thank you. That's the answer I wanted. Thank you very much. That's correct. Good. Now tell me, after you gave them desmopressin, how many times a night were they getting up on average to go to the toilet? Because I haven't seen this data.
The number of urinations in my patients reduced to 2 or 3 times a night.
Okay.
Oh.
Well, have you got that data somewhere?
Unfortunately, I don't have a slide with this data, with these numbers.
Have you published a paper for it? Because nobody else in the world has had a 50% reduction in nocturia episodes with desmopressin.
Потому что нигде в мире не удалось...
I will say that again. Nobody else in the world has had a 50 or 60 or 70% reduction, which you are talking about, in nocturia with desmopressin. If that is the case, you should publish your results in an international journal. It will be very interesting to read.
Thank you for your comment. I will certainly send you a message with the exact data from my thesis for more in-depth analysis of my data.
Okay. See, Dr. Osipova, the only thing I received in English, and I'm sorry, I wish I could speak Russian. I'm a very great admirer of the Russian culture and history, and I wish I could speak Russian, but I cannot. So I had to rely on a summary. Okay, thank you. Let me summarize then. I would advise you to look at the data of what happens of nocturia cure with uterosacral ligament repair. There's some very good data from the St. Petersburg Urology Department. They have very good data on cure of overactive bladder, urge, frequency nocturia with a posterior sling, the hybrid sling, and I urge you to read that data. Let me summarize then. I'm sorry I've taken so much time. Let me summarize. I think your scientific work in determining the osmolality of these conditions is very good, and I would recommend acceptance of your doctoral thesis on that basis. Thank you very much.
Ну, два слова по...
Couple of words. Could you please, I suggest Professor Smirnov to comment. Professor Smirnov will comment in Russian. The matter is that the author studied the volume of urine per night that leads to urge to go to toilet. The amount of volume increases, so the frequency of urination increases. Desmopressin is an analog of vasopressin, which reabsorbs water and reduces diuresis. And so the author got this idea from the works of urination in children. And so she studied this in non-pregnant women, and desmopressin led to a reduction of nightly diuresis in the work that you have shown. Perhaps there are different studies, but in this study, a statistical difference against take of desmopressin. Thus, the author proved two facts: that frequency of urination at night in women is reduced because of smaller amount of urine. That's fact number one. And the second fact is that desmopressin, the author did not aim to treat these patients, but to prove that in genesis, increase in nightly, the vasopressin has a role to play in this process. So these are the two facts the author tried to demonstrate. I absolutely agree with the comments you have given, but obviously there is a difference in understanding the symptoms in Russian and English speaking or English language literature. Thank you. Let me present my review, and considering our discussion was quite detailed and my review was published at the website and we didn't have so much time, let me focus on the key points that reflect the essence of the thesis, which impressed me. First of all, I'd like to say that it's an honor for me to be to participate in this dissertation council at this world-known university. Also, it's a great pleasure for me because I read an excellent paper, which is a step in managing incontinence. This is my sincere belief. The most important thing for me is the relevance of this issue. It's highly relevant because the number of women in of reproductive age and postmenopausal and during pregnancy shows that this problem is very common, and the fact that it became a multidisciplinary study which is now being studied even by psychologists, and so it's indeed the problem is highly relevant. It should be mentioned that some years ago we saw a dramatic decline of interest in urogynecology, which started maybe 15 years ago when the pelvic pathology center was established, and we started exploring this problem. We worked in the sphere of reconstructive surgery and conservative treatment, and we achieved some success, but of course we cannot be satisfied with the results yet. So Natalya Anatolyevna's work is logical, is very important and unique in the way the author sets her tasks. So we focus on a particular period of this disorder, but here Natalya Anatolyevna she found a unique way to explore the connection between incontinence and renal function, and I think this is the main achievement which allowed to achieve results. This was a very large-scale study in the assessment of incontinence mechanisms in pregnant women, who are all naturally women of reproductive age. The thesis also explains diagnostic principles for women of reproductive age with incontinence. The thesis studies mechanisms of urine formation, clinically explains the use of synthetic analog of vasopressin. I agree with the participants of this discussion that this chapter has a reason to be written, because vasopressin is a kind of a test how soon a patient's bladder fills up. And so if there is such a contradiction in literature, this happens, but what vasopressin should be explored further as a test, as potential treatment. I think, yeah, this could be done. So, both vasopressin and prostaglandin synthesis inhibitors, they can be used to standardize treatment. So we are quite sick and tired of the clinical protocols, which are beyond any criticism, but we are making progress. So we're talking about personified approach, and in this work Natalya Anatolyevna leaves some space for individual approach, and that's the optimal treatment. There's nothing new there, of course. We've been taught to treat not a disease but the patient. And Natalya very opportunely remembered that and included this in her work. The thesis is logical. The conclusions are well explained, and the material is huge, immense. She examined it with the help of modern mathematical tools. When the author designed her study, she kept in mind the practical implementation of her results. So here, the practical implementation is obvious, and I think that's an excellent contribution in the practice of urogynecology. I don't have any critical remarks, but I would like to ask a question. Why, in your thesis, you limit yourself to women of reproductive age, while urinary incontinence and nocturia are more common in older women? And not to get back in my opinion, the thesis complies with all the requirements, and the author, the candidate, deserves being awarded the doctoral degree. So please answer my question. Dear Eduard Karpovich, thank you for your review and for the question. Since age and associated changes in renal function, such as filtration rate, concentration capacity, and sensitivity to hormonal regulation, have an impact on urine formation, and after the age of 50, the amount of urine excreted at night doubles, and by the age of 60 and older, there is a marked depression of indicators reflecting the renal function. We included only women of reproductive age in our study. I'm satisfied with the answer, and I would like to answer all the council members. If you're satisfied with the applicants' answers, candidates' answers, is anyone present willing to speak? No. In that case, I beg your pardon. Oh, I didn't see you. Professor Chiremisin, head of Department of Oncology. I listened to the presentation and the opponents' speeches, and I have indeed the impression that this issue is highly relevant, and to me, as an X-ray specialist, at our sessions of St. Petersburg X-ray Society, we discussed in these issues, we discussed older women with this condition, and for the first time there we learned that in order to assess the condition of incontinence, various studies, examinations are conducted, such as an ultrasound scan, and some enthusiasts are using even MRI to assess the ligament condition. And for me today, I got a new insight into this problem. It has other aspects connected with renal function, the opportunity not only, as we believed, to correct or to adjust incontinence surgically, but to achieve certain results. I believe that this work is very important. As was said by the author, every 1 in 5 women suffers from this condition, and attention to this problem, I think, is extremely important and is highly relevant. And I support this thesis and the conclusions made by the author. Thank you. Thank you very much. Is anyone else willing to speak? Elena Ivanovna Rusina has, dear colleagues. I would like to say this. Of course, it's hard to contradict such a respected expert as Professor Petrus. We all know his works with ICS, and we know the terms used by ICS. The explanation of the difference of the results published earlier. It could be related to the fact that Natalya Anatolyevna used desmopressin, administered desmopressin to the group of patients who had disruption in osmolality. So polyuria, nocturia can be caused by various reasons. This is a fact. Glucose, urea, because of different types. So this was a group with electrolyte disorders. So maybe this explains the high efficiency. And so diagnostics, analysis, and then administering, and then we can achieve high efficiency. Thank you. Thank you.
Well, hold on. Desmopressin is contraindicated in older women because it causes electrolyte disorders, sodium depletion. It is recommended that they don't use it in women older than 60. So I'm sorry, but, I have to tell you these things. Okay.
Thank you, Professor Pop. Also would like to say something here. We are talking about young women up to 40, and vasopressin at certain periods works differently. After 60, there is no need to administer this medication, but in young women, it's possible. It could be useful. Thank you. Since we have not received there are no other speakers. Let me give the floor to the academic advisor, Professor Niauri. Dear Eduard Karpovich, dear council members, dear colleagues and guests, for me, I'm very happy and very proud to introduce Natalya Anatolyevna, who is the first graduate of our medical school that was founded by great nephrologist academician Yuri Anatchev. And Natalya Anatolyevna is a good representative of this school. She started her research since her first year at the university. So our faculty turned 25 years, and so she's been with us during 25 years with clinical and practical work. As a result, she's an associate professor of gynecology and obstetrics department, and very successfully combines her research, her clinical work, and teaching. She worked at various maternity institutions. So this material is unique, and she collected it during her independent clinical work. She mastered many labor-intense methods. Natalya Anatolyevna today is a doctor, a highly qualified doctor. She's a head of department in Almazov Center, and she's much respected by her colleagues. If you ask her colleagues, they remember her since the time she was a young doctor. And the opinion is, they all have the same opinion that Natalya Anatolyevna is, I'm so sad because everything went well. This is just a discussion, and thank you, Professor Petrus, for speaking, Professor, for starting a discussion, because this is very interesting. And I'm sure that Natalya Anatolyevna, as a creative person, she's very modest. She's not a public person. She has a great sense of responsibility and dignity. And I think it made it difficult. And of course we understand she's worried. And of course it's up to the council members to judge on the quality of her work. Thank you. Again, is anyone else willing to speak? Any of the council members or anybody present here? No.
Look, I'd like to clarify. I would like to clarify my comments. I think her scientific work is of a very high quality, and I congratulate Dr. Osipova on her scientific work. It is very diligent, very difficult to do, and she's done it very well. So I would like to separate my comments from the scientific work, which I think is very good, from the clinical work, which I think is not consistent with my experience of nocturia. I emphasize, I recommend this doctorate, and I congratulate Dr. Osipova on her scientific work. It is very good. Thank you.
Thank you. In Russia, we have we have a saying that every mind is different. Since there are no questions, so let us finish our discussion. And according to the procedure, before we summarize, before we vote, I have to ask the applicant and the council members if you have any comments to the procedure of today's session. No, thank you. Then let us move on to the next item on our agenda. Let us proceed to voting. And again, I have to ask, do we need a break to discuss the results, or can we proceed vote, right? So we can proceed to voting, right? Then I have to make sure we can all see and hear each other. And since everybody is quiet, I assume we can all see and hear each other. I put a question of awarding to Osipova Natalya Anatolyevna the degree of Doctor of Medical Sciences, the specialty 140101, Obstetrics and Gynecology, to open individual vote. Let me remind you that a decision of the Dissertation Council on awarding a degree shall be considered positive if more than a half, but not less than 3 members of the Council present at the meeting voted for it, according to Article 23 of the Order. So first, I'd like to ask Arzhanova Olga Nikolaevna, your opinion, please. I think the thesis corresponds to the applicable requirements, and my opinion is positive. Thank you. Council Member Mozgova Yelena Vitalyevna, the author deserves being awarded the degree of Doctor of Medical Sciences. Thank you. Council Member Rusina Yelena Ivanovna, I vote for awarding the degree. Council Member Smirnov Alexei Vladimirovich, I vote for. Thank you. Council Member Kamilova Marhabo Yadgarovna, I vote for awarding the degree. Thank you. Council Member Petrus Peter Emanuel Papa, your opinion?
Yes, I vote for awarding the degree. Thank you.
Thank you very much. Dear Nikolai Nikolaevich, your opinion, please. I vote for awarding the degree. Thank you. Me, as a chairman, also vote for awarding the degree, and I give my opinion once again as for counting the votes. Thus, dear colleagues and guests, let me inform you that out of 8 council members, out of 8 voted for, no one voted against, and no one abstained. So the decision to award to Osipova, Natalya Anatolyevna, the degree of Doctor of Medical Sciences, Specialty 140101, Obstetrics and Gynecology, has been made. As now I would like to give the floor to the applicant for her closing remarks. Dear Eduard Karpovich, dear council members, let me thank you for the time devoted to analysis and for taking part in this council. Let me thank my academic advisors who helped me, Yuri Viktorovich Natochin, the first dean of the medical faculty, who made me interested in science and allowed me to work at the Evolution Physiology Institute, Deriko Alexander Nauri, under whose guidance my student work turned into a doctoral thesis. For her support that gave me strength to move forward. Eduard Karpovich Almazan and my colleagues of the Institute of Obstetrics and Gynecology for generosity with which they shared their knowledge, and for all the speakers for being interested in my work and for the live discussion for the patient. I thank the Dissertation Council Activity Support Department for technical assistance, preparing the translators who helped us understand each other and gave us the opportunity to speak the same language. Today is the result not on the many years of my work, and today altogether we made one more step to preserve female health, the health of our mothers, sisters and grandmothers. Thank you. Once again we congratulate you. Thank you very much. Let me once again congratulate you, since this defense gives us the opportunity to invite highly qualified researcher and, what is more important, clinical expert. We need so much in such let me thank all the council members and our foreign colleagues for taking such an active part in our work. Thank you so much. At that, I declare the meeting closed. Thank you.